Hi, my name is Dola Abiodun, and this is my signature assignment on clinical experience at Neurobehavioral Health Associates. This is a picture of Neurobehavioral Health Clinic. It is located in Snellville in Georgia. My best experience there was anytime my preceptor discusses the mechanism of psychiatric drugs relating to the psychiatric disorders, and also when drug reps visit the facility by discussing medication use, adverse side effects, mechanism of action, and disease process. My worst experience was when COVID made it impossible to get the experience of having another preceptor in psychotherapy. This made my preceptor step in to fulfill that role by scheduling psychotherapy interviews and follow ups. My preceptor, I learned only from one preceptor, and my preceptor is a psychiatric mental health nurse practitioner. She had a very great, immense experience in caring for psychiatric mental health patients at different age groups, and this really helped. And she also had a very vast psychiatric mental health illnesses experience. What I wish to have done differently, I wish I can change mostly the COVID-19 pandemic not occurring in the first place. This is in order to have that other input from another preceptor, possibly a psychotherapy. Also, I wish to have had the experience of having that face-to-face contact with the patient instead of the teleconferencing experience. Relating psychotherapy with medication management, definitely, I developed a deeper knowledge of how psychotherapy and medication management are interchangeably. They are they are interchangeably to help patients attain a therapeutic goal. The objective comment of my preceptor was very kind-hearted. She is all about humanity as a whole. She has passion for helping her patients. She's very knowledgeable about psychiatric mental health. She's also very empowering. She's delighted to share her experience and knowledge, and she empowers you to gain more knowledge and insight into psychiatric mental health. The style of my preceptor, she will have you discuss each client and their interventions and plan of treatment immediately after each case contact when possible. She listens to your rationale for the treatment plan as well as the evidence-based treatment recommendations. The facility was really friendly and warm. The staffs were open-minded and accommodating. They were also very resourceful to their clients. I wish the psychotherapists in this facility were open to precepting students and sharing their knowledge. Overall, it was a very good experience, and I will highly recommend this facility to other future students. The facility, if I can describe it, it is a very clean environment. It was really quiet and therapeutic. They provide care to mostly suburban residents of all races. They provide care to both insurance and private pay patients, and they provide various psychiatric interventions. I had experience with providing care for pediatric population, and I experienced how it can be challenging to incorporate the families into treatment in the sense of having to involve the community, such as the family members, the caregivers, or schools in the care of the patient. I learned very much of starting their medication with the lowest dose. I also had experience with providing care to the elderly and also including their family members, caregivers who may not live with them but interact with them. I learned mostly how this population can indulge in polypharmacy and how this can affect their medication mechanism of action. Finally, the adult population had the vast majority of my experience, and this can be challenging and because they have the multiple mental health illnesses. My preceptor made use of genetic testing, which was really very helpful, and she used it to guide our choice of medication management. The experience overall that I wish to have gained was during this time was to really treat substance abuse patients. I didn't get to, treat or learn how to, manage the care of substance abuse patient. And also, I didn't get to have any inpatient psychiatric encounter. Provider services. The provider services the facility provide they have a very vast major variety of mental health treatment. This included attention deficit, hyperactive disorder, adjustment disorder, anger issues, anxiety disorders, which includes generalized anxiety disorder, obsessive compulsive disorder, post-traumatic stress disorder, panic disorder, separation anxiety disorder, and also social anxiety disorder. Also, they treated patients that had bipolar or mood disorder, such as depressive disorder or postpartum depression, situation depression. They also did disruptive disorders such as conduct disorder, oppositional defiant disorders. The overall experience with the patient was very satisfactory and insightful. I expected more than what I got because I was hoping for the face to face contact with the patient. However, due to the pandemic, I'm still very grateful for this experience. Of course, I still want to be a psychiatric mental health nurse practitioner. I was not able to see patient alone. I wish I was able to, but my preceptor stated the clients were not comfortable because of the pandemic and everything. There was more anxiety going on with most of our patients. And I did not get to discuss or learn the business side of being a psychiatric mental health nurse practitioner. I was really interested in this aspect because I hope to at the end of the day have my business or have the business of my own. I do understand the billing somewhat and coding from being an FMP. I've been an FMP for close to 6 years now, and during immersion, I also learned a lot about being about the business side of being a PMHMP. The role changing, I plan to work part time initially as a PMHMP. I really do not want to stop practicing as a FMP for now. I feel that I'm ready to take on the job as a PMHMP, and yes, I was really prepared. I feel like I'm really prepared and I can carry on that role by my preceptor to face the future as a PMHMP. Personally, I think differently now from the past. Even during my work hours as an FMP, I feel confident to care for mental health illnesses due to increased critical thinking skills. No, my population of patients I would want to work with has not changed. As an FMP, I see patients of all ages. As a PMHMP, I also want to see patients of all ages. And because I really feel comfortable caring for all age groups. And that is the end. And thank you so much for listening. And thank you.